meeting sponsored by the HSDR, and we have also members here from the VA Health as well today. So I'll just say a few words, and then I'll turn it over. Then we'll do some introductions of the panel members. We'll have some announcements, and we'll begin with some formal presentations. So the goal is to provide plenty of time for questions and answers and dialogue and interaction. So the ATSGR, that's the Agency for Toxic Substances and Disease Registry, it's part of the Centers for Disease Control, has been working for decades to address the health concerns associated with drinking contaminated water and other exposures from the contamination at Camp Lejeune, North Carolina. One of the things we'd like to do tonight is, this morning, is to review some of the studies that we found, some of the results that we found, as we want to make sure that there's an understanding of the work that we've done and how it might affect your lives, and how that's translated, more importantly, into programs at the VA that will be a benefit to you as veterans going forward. So we bring our community assistance panel with us to this meeting. So our work at HSDR is informed by interaction with members of the affected community, including veterans, family members, and other concerned citizens. And some of those CAP members are with us today to help answer your questions and address their perspective. We have a series of CAP meetings, that's the Community Assistance Panel, every year, usually in Atlanta. One meeting a year we try and have somewhere else in the United States so we can have an opportunity to reach out to the impacted communities where you live. So in this case, we're in Pittsburgh. We've been in Florida, we've been in North Carolina, for example, over the last few years as well. So that's the purpose of today. So while we do our regular business, last night some of you attended, where we talk about the work that we do and we get input and discussions amongst ourselves. The purpose of today is really to create a dialogue. So that's about all I'd like to say. I'll begin by introducing myself. My name is Patrick Bricey. I'm the director of the Agency for Toxic Substance Disease Registry, CDC. I work in Atlanta, and I have some colleagues with me here today.
My name is Frank Levey. I'm an epidemiologist with ATSDR.
Good morning, my name is Rick Gillig, and I am the management lead on a couple of the projects. I'll be talking about the soil vapor intrusion project later this morning.
Good morning, my name is Mike Partain. I'm a dependent. I was born in Camp Lejeune in 1968, diagnosed with male breast cancer about 11 years ago. I've been involved in the Camp Lejeune as a camp issue, as a camp member, since I completed my chemotherapy about 11 years ago.
My name is Jerry Ensminger. I'm a retired Marine. I've been involved in Camp Lejeune since August of 1997. So, Semper Fi.
Good morning. My name is Lori Freshwater, and I was a dependent on base. I lived there in the early 80s for about 3-4 years. And I lost 2 brothers to neural tube defects, and my mother died of 2 types of leukemia. So I've been on the CAP for a few years now. Thank you.
My name is Pat Hastings, and I retired after 33 years in the Army. I feel a little outnumbered. But very glad to be here and really appreciate ATSDR inviting the VA. This is an important role that the VA has to make sure that we do take care of the veterans, the Marines. And working with ATSDR, we've come up with some, not perfect, but a good way to look at this garrison exposure. And this was historic. It was the first garrison exposure. And we're trying to do right by you. So we thank you for your participation. And this is important for the VA, and we appreciate being able to come to the table. Thank you.
Scott Hobbs, I'm with the VA. Myself, I'm a former Navy veteran, Seabees, for I'm sure a lot of Marines out there have heard of the United States Navy Seabees as well.
Good morning, I'm Gail Beatty. I'm a Program Management Officer at the VA Office of Community Care, and I'm over the Family Member Program.
Good morning, my name is Lorraine Carson, and I am an acting senior advisor in compensation policy, and I work with the Veterans Benefits Administration. I wanted to also let you know that With me today is the Pittsburgh Regional Office staff and some compensation service folks who, if you have any questions about the status of your pending VA claims or any information that you need with regards to healthcare eligibility, family services, we have a group of folks who are in a room that's adjacent to this room who will be here all day to answer any questions that you may have, and I'm glad to be here to support.
And good morning. I'm Alan Dinesman. I'm the medical officer for the Office of Disability and Medical Assessment at the VA, and I want to thank everybody for attending this morning.
Good morning. My name is Jamie Mutter. I work with the ATSDR, and I am the Community Assistance Panel Coordinator.
I'd like to introduce Gail Beatty. She's already introduced herself. She's the director of the Family Member Program. Very important, and this was historic. This is the first time that we've had a garrison-based exposure, a garrison-based, which included family members. And so the Family Member Program was stood up so that we could take care of the family members for those out-of-pocket expenses that were not covered. And Gail will be going over that, and if there are any questions, we can either take those for the record or we can answer those here. So I'll turn it over to you, Gail.
But again, I'd like to remind people we can wait till the end to answer questions. That'd be great.
Once again, good morning. And what I'm going to do is give you a very high-level overview of the program. What we do in the VA Office of Community Care is we process the eligibility, make eligibility determinations for the family members, and we pay the medical claims to either the family member directly reimbursing them for their costs or the providers that provide them the care. So Public Law 1112-154 was enacted excuse me, on August 6, 2012. Section 102 requires VA to provide health care to veterans who served on active duty at Camp Lejeune and reimbursement of medical care to eligible family members for one or more of 15 specified illnesses or conditions listed below. To be eligible for VA health care, a veteran must have served on active duty at Camp Lejeune for at least 30 days between August 1st, 1953 and December 31st, 1987. The veteran does not need to have one of the 15 health conditions to be eligible to receive VA health care. Veterans do not need to be a service-connected disability to be eligible as a Camp Lejeune veteran for VA health care. VA health care related to any of the 15 qualifying health conditions is at no cost to the veteran, including co-payments. Camp Lejeune veterans are enrolled in VA health care in Priority Group 6 unless they qualify for a higher priority group. VA began providing care to Camp Lejeune veterans on the day the law was enacted, which was August 6, 2012. As of March 31st, 2018, VA has provided health care to 52,688 Camp Lejeune veterans, 3,211 of which were treated specifically for one or more of the 15 specified Camp Lejeune-related medical conditions. And Camp Lejeune veterans interested in enrolling, we've got a phone number there, but again, we have the room next door that's got all the information that you would need. The table below displays the number of veterans who have been treated for each specific Camp Lejeune medical condition. And as you can see, the renal toxicity is the highest. We've got bladder cancer as well, and hepatic steatosis is the three most common. So for the Family Member Program, the Camp Lejeune Family Member Program launched on October 24th of 2014, which is the day the regulation became effective. Family members receive care by civilian providers, and VA reimburses, as payer of last resort, out-of-pocket medical costs associated with the 15 conditions. Family members may request reimbursement for covered expenses incurred up to 2 years prior to the date of application. As of March 31st, 2018, there are 1,839 family members administratively eligible, 537 family members clinically eligible for one or more of the 15 covered conditions. VA has provided reimbursement to 372 family members for claims related to treatment of one or more of the 15 conditions. And again, we have fact sheets, we have enrollment forms next door for family members. To receive reimbursement for medical expenses, a Camp Lejeune family member must be determined administratively eligible for the program, which means they must have had a dependent relationship to an eligible veteran during the covered time frame. The family member must have resided, to include in utero, on Camp Lejeune for at least 30 days between August 1st, 1953 to December 31st, 1987, and have one or more of the 15 qualifying health conditions. And again, that's for medical expenses. There would have to be a determination of clinical eligibility. So the table below displays the number of family members who were treated for at least one of the 15 Camp Lejeune medical conditions. There are some that have more than one on this table. As you can see, the breast cancer is by far the most common. So eligibility denials for veterans. Of the 52,688 veterans who applied for care and services, 1,451 were ineligible due to not meeting the statutory requirements for veteran status. Family members of the 2,615 applications received for medical benefits in the Camp Lejeune program, 776 were ineligible due to the following reasons. The veteran was eligibility criteria, relationship to the veteran, or a residency requirement. Family member claim rejections. One of the largest was the submitted medical claim was completely paid by the family member's health insurance. Again, we are secondary or payer of last resort. If the family member has no insurance at all, we would be paying the entire bill for one of the 15 conditions. The family member provider did not submit the required explanation of benefits from the insurance company. So when you have other health insurance, you get your explanation of benefits, which tells us how much the family member had to pay out of pocket. If we don't have that, we don't know how much to pay, so the claim would be rejected. But as long as that explanation of benefit is given to us along with the bill, we were able to pay. The prescription was not covered by approved drug formulary list. The bill was previously submitted and considered. We get a lot of duplicate, family members will send in a bunch of claims, and then the claims, some of them are duplicates, so of course we can't process those. And the diagnosis code on the medical bill was not covered for the approved condition. We have a nurse review for some of them. If there's a question, a nurse will review it for payment. And if the diagnosis code on the medical bill was something other than for the approved condition, it is denied. So expenditures for fiscal year 18. So far, we have reimbursed family members $18,756, and we have made $427,009 paid directly to the providers. And the cumulative total through fiscal year 18 is $659,154 to family members. Because again, they can go back 2 years for claims. And the payment to family member providers, $1,920,34. So we also have down here, just so you can see, for over the past, since the program started, for fiscal year administratively eligible, we had 714, and it's even if we doubled fiscal year 18, it continues to go down. So hopefully we've reached the saturation point, and it'll continue to go down because we will no longer have new family members coming into the program because everybody is already in it. And clinically eligible, you can see that has gone down drastically from fiscal year 15, which is good news.